What if I told you that one of the most popular exercises, something you might be doing every day to improve your health, could actually increase your risk of having a stroke? You might be shocked to hear that the very workout you've been told is good for you could be a ticking time bomb. Stick around, because by the end of this video, you'll understand exactly why this exercise could double your stroke risk in a matter of hours, and what you can do to protect yourself. It's easy to believe that all exercise is good exercise. After all, we've been hearing for years how important physical activity is for our overall health. It helps us keep weight off, strengthens our muscles, boosts our mood, and even improves brain function. But what if I told you there's one kind of exercise that, when done improperly, could have the opposite effect, especially on your brain? It's something that many people do regularly without thinking twice. The exercise I'm talking about is high-intensity interval training, or HIIT. High-intensity interval training is everywhere these days. It's the go-to workout for anyone looking to lose weight fast, boost endurance, and get that toned body we all want. HIIT sessions are packed with explosive movements, quick bursts of energy, and short rest periods. Sounds great, right? It seems like the perfect way to get the most out of your workout in a short amount of time. But there's a dark side to it that very few people talk about. The problem with HIIT lies in how intensely it forces your body to work. When you push yourself to the max, especially during intense bursts, your heart rate spikes. Your blood pressure rises significantly, and your blood vessels constrict to push blood where it's needed most, mostly to your muscles and organs working hard during the exercise. But here's the problem. This sudden dramatic increase in pressure can cause a strain on your blood vessels, especially the delicate ones in your brain. And that's when trouble can begin. Now, you might be wondering, but how could something as simple as exercise cause a stroke? Here's the thing. When you put your body under extreme pressure, as you do during HIIT, it triggers a chain of events in your body. The sudden increase in blood pressure can cause tiny cracks in your blood vessels, weakening the walls of your arteries. Over time, this can lead to the formation of dangerous blood clots, which can block blood flow to the brain, resulting in a stroke. It's this kind of strain that leaves many people vulnerable, even if they feel fine at the time. But here's the real kicker. This doesn't just apply to people with pre-existing health conditions. In fact, even those who consider themselves perfectly healthy can be at risk if they push their bodies too hard, too fast. The body can only handle so much before it starts breaking down under pressure. And when that happens, your brain becomes a target. Research has shown that people who do high-intensity exercises regularly are at a greater risk of experiencing these dangerous spikes in blood pressure, which can increase the likelihood of a stroke occurring in vulnerable individuals. Before you dismiss this as just another worried health expert scenario, think about this. Medical studies have shown that the stress induced by HIIT workouts has been linked to increased stroke risk in both younger and older adults. Yes, people who have no prior health problems can still be affected by these high-intensity routines, and that's why it's important for you to know the full story before you lace up your sneakers and push yourself to the limit in your next workout. So why am I telling you all of this? Because I want you to make informed decisions about your health, and I'm about to share some eye-opening information with you. If you've been doing HIIT thinking it's the perfect way to stay in shape, you might need to rethink that approach, especially if you're not seeing the right kind of results, or if you're feeling any unusual discomfort during or after these workouts. Stay tuned, because I'm about to tell you what exactly happens to your body during these intense workouts, and how you can protect yourself from stroke risk without having to give up on getting fit. Trust me, you won't want to miss it. So let's dive deeper into why exactly this happens and how the connection between high-intensity exercise and stroke risk works. It's important to understand that the body's response to stress is complex. When we engage in high-intensity workouts like HIIT, our bodies go through several immediate, intense physiological changes. The heart starts pumping faster to meet the increased demand for oxygen by the muscles. Our blood vessels constrict to push blood to where it's needed most. This process, while natural in the short term, is taxing on our system, especially the cardiovascular system. The most significant risk, comes from how our body responds to the rapid and extreme changes in blood pressure. During intense exercise, our blood pressure can skyrocket to levels far higher than what our body experiences during typical activities. And while this surge in pressure is manageable for many, it poses a real threat for others, especially those who may have underlying conditions they don't even know about. Blood pressure that spikes too high too quickly can put strain on blood vessels, particularly the smaller, more fragile ones in the brain. Over time, this can weaken the walls of these blood vessels, making them more susceptible to rupture or blockage. This is when the real danger of a stroke becomes evident. Now, you might be asking, why would this happen even to someone who is healthy? Well, your body is designed to cope with temporary increases in stress. However, if you push yourself too hard too often, or if you're doing high-intensity workouts improperly, your system starts to pay the price. For instance, when you do multiple high-intensity intervals with little rest, your heart and blood vessels are in a constant state of high stress. This can lead to a sustained increase in blood pressure, making it harder for the body to recover fully between bursts of intense effort. When this happens repeatedly, it can create a perfect storm for something as serious as a stroke. It's also crucial to consider how the body's natural recovery processes are disrupted in a high-intensity environment. During a regular, less intense workout, your body has enough time to gradually reduce your heart rate and return blood pressure to safer levels. But in HIIT, the short rest periods between bursts of activity don't give your body enough time to recover properly. As a result, your blood pressure may stay elevated for longer periods, putting even more pressure on your blood vessels and increasing your stroke risk. But it's not just the high-intensity bursts that are problematic. The problem comes from the cumulative effect of these workouts. When you do HIIT repeatedly, the repeated strain on your cardiovascular system can lead to long-term issues that may not be immediately noticeable. You may feel fine during or after your workout, but the toll on your blood vessels and your heart can build up silently over time, setting the stage for a stroke or other cardiovascular event down the line. Now, this isn't to say that HIIT is inherently bad or should be avoided altogether. There are certainly benefits to high-intensity workouts, especially when done properly and in moderation. The key lies in understanding your body's limits and adjusting your routine based on your personal health needs and goals. For example, if you have high blood pressure, heart disease, or a family history of stroke, it's important to take extra precautions and consult with a healthcare provider before engaging in high-intensity training. In these cases, gentler forms of exercise like walking, swimming, or cycling might be safer options. These activities still provide tremendous cardiovascular benefits without putting undue stress on the body. Even for those without a pre-existing health condition, moderation is key. You don't need to go full throttle every time you work out. It's crucial to listen to your body and make sure you're not pushing yourself too hard. If you notice any signs of dizziness, unusual fatigue, or chest discomfort during your workout, it's important to stop immediately and seek medical advice. Your body is telling you that something is wrong, and ignoring those warning signs could have serious consequences. For those who are new to exercise or are just getting back into a fitness routine, it is especially important to start slow and gradually build up to more intense workouts. Your body needs time to adjust to the demands of exercise, and rushing into high-intensity workouts without a solid foundation can increase your risk of injury and other health complications, including stroke. A good rule of thumb is to focus on building endurance and strength with moderate exercises first, then slowly progress to higher intensity routines once your body is prepared. If you're already doing HIIT and feeling great, that's fantastic, but it's still important to check in with your health regularly. Annual physicals, monitoring your blood pressure, and taking note of any unusual symptoms can help you stay on top of your health. If you're already in a high-intensity workout routine, consider balancing it with lower-intensity activities throughout the week to give your body a break and reduce the constant strain on your cardiovascular system. Think of it as giving your heart and blood vessels a chance to recover and reset. Remember, exercise is one of the best things you can do for your health, but it's also important to exercise smart. It's not about pushing your body to the limit, but about finding the right balance. Keeping your stroke risk low while staying fit requires understanding how your body responds to different levels of exertion. You want to choose exercises that support your long-term health, not put your body under unnecessary stress. By being mindful of the risks and taking a more balanced approach to fitness, you can enjoy all the benefits of exercise without compromising your brain or heart health. Understanding the risks associated with high-intensity interval training is critical, but there's more to the story. Let's take a closer look at what happens in your body when you engage in these intense workouts and why you should pay attention to the signs your body is giving you. Most people don't realize how quickly things can go wrong during these high-stress exercises, especially when you push your body beyond its natural limits. When you start a HIIT workout, your body is immediately thrust into a state of fight or flight. This is because high-intensity exercise puts your body under acute physical stress, demanding more oxygen and energy than your system is typically prepared to handle. During these intense bursts of activity, your heart rate rises rapidly and your blood pressure can go through the roof. This extreme surge in pressure affects more than just your heart. It impacts your blood vessels too. And the more often you do this, the more pressure you put on your cardiovascular system. As the intensity of the workout increases, your blood vessels constrict to push blood toward the muscles working the hardest. This temporary constriction is a normal physiological response during exercise. But the problem arises when this sudden constriction becomes too frequent or too extreme. Over time, the stress on your blood vessels can cause them to become weaker, less elastic, and more prone to damage. In particular, the smaller blood vessels in the brain are most vulnerable. These vessels are far more fragile than the ones in the rest of your body, and they can't always handle the sudden changes in blood pressure that happen during high-intensity workouts. The result? An increased risk of stroke. It's important to remember that while your body is incredibly resilient, it also has its limits. The more often you push your cardiovascular system to the edge, the more likely it is that you'll begin to see negative consequences over time. These consequences might not show up right away, but the damage accumulates silently in the background. That's why you can't always rely on how you feel during a workout to tell you if you're at risk. Just because you're not experiencing dizziness, chest pain, or shortness of breath doesn't mean your blood pressure isn't spiking dangerously high. When your blood pressure spikes during a HIIT session, it's not just a temporary increase. The effects can last much longer than the workout itself. Studies have shown that after intense exercise, your blood pressure can remain elevated for hours. This prolonged high blood pressure puts additional strain on your blood vessels, particularly the ones leading to your brain. The longer the strain lasts, the higher the chances that you'll experience a rupture, clot, or blockage in one of these vital blood vessels. In some cases, this can result in a stroke. This is why it's crucial to approach high-intensity training with caution, especially if you have any underlying health conditions. But even for those who are in excellent physical condition, HIIT is not without its risks. For someone with high blood pressure or a family history of stroke, these risks become even more pronounced. Even if you feel fine and can push through the workout, your cardiovascular system might not be as resilient as you think. But what about people who have no pre-existing health conditions? Are they safe from these risks? Unfortunately, the answer isn't so simple. Even healthy individuals can experience spikes in blood pressure during high-intensity exercise that can increase their stroke risk. And just like people with health conditions, they may not realize the damage that's being done during these intense bursts of exertion. The truth is that stroke risk doesn't discriminate. It can affect anyone, regardless of age, fitness level, or overall health. And in many cases, the damage done by intense exercise may not show up for years, making it even more dangerous. So, what can you do to protect yourself from the hidden dangers of high-intensity exercise? The key is moderation and mindfulness. If you're someone who enjoys HIIT and wants to continue doing it, that's perfectly fine. But you need to be mindful of your limits and take steps to reduce the strain on your cardiovascular system. This could mean reducing the intensity or frequency of your HIIT sessions, allowing more time for recovery between workouts, or incorporating lower intensity activities like walking or cycling into your routine. Another important factor to consider is how you approach your warm-up and cool-down. A proper warm-up can help gradually increase your heart rate and blood flow to your muscles, reducing the risk of sudden spikes in blood pressure. Similarly, a cool-down session allows your body to slowly return to its normal state, which helps lower your blood pressure more gradually. Skipping these crucial steps can put additional strain on your cardiovascular system, making it harder for your body to recover from the intense exertion. If you're unsure whether HIIT is right for you, it's always a good idea to consult with a healthcare professional. They can help assess your overall health, including your blood pressure, heart health, and stroke risk. In many cases, your doctor may recommend alternative forms of exercise that provide the same benefits without the heightened risks. Even simple activities like walking, swimming, or yoga can improve cardiovascular health and keep your body in great shape without putting unnecessary stress on your blood vessels. Lastly, listen to your body. If you feel dizzy, lightheaded, or uncomfortably fatigued during or after a workout, it's essential to take those signs seriously. These could be indications that your blood pressure is spiking too high or that your body is struggling to handle the intensity. Don't ignore these warning signs. They're your body's way of telling you that something isn't right. Staying fit and healthy is incredibly important, but so is staying safe. By understanding the risks associated with high-intensity exercise, being mindful of your body's limits, and incorporating smarter, safer workout strategies into your routine, you can reduce your stroke risk while still reaping the benefits of physical activity. Always keep in mind that fitness is not about pushing your body to the breaking point. It's about making sustainable, healthy choices that will keep you strong and safe for years to come. It's easy to think of exercise as an inherently good thing, and in many ways it is. Regular physical activity is crucial for overall health. It strengthens the heart, boosts mental clarity, and reduces the risk of numerous diseases. But as we've explored, the benefits of exercise come with a caveat, especially when it comes to high-intensity routines. If not done properly, even something as beneficial as exercise can have unintended consequences on your health. And that's why it's so important to not just exercise, but to exercise wisely. The good news is that there are plenty of ways to stay fit and healthy without putting yourself at risk. It starts with understanding that not all workouts are created equal, and there's no one-size-fits-all approach to fitness. If you've been relying heavily on HIIT to get in shape, it might be time to reassess whether this high-intensity method is the best choice for you, especially when there are so many other effective, safer options to explore. In fact, lower impact exercises can often provide the same cardiovascular benefits without the heightened risk of injury or stroke. One of the most effective alternatives to HIIT is moderate intensity exercise, which doesn't push your body to the extremes that HIIT can. Activities like brisk walking, swimming, or even cycling can provide great cardiovascular benefits while keeping your blood pressure in a safer range. These exercises still challenge your body, but they do so in a way that's more sustainable over time. For example, brisk walking is an excellent low-impact cardio exercise that gets your heart pumping without causing the intense spikes in blood pressure associated with high-intensity workouts. It's gentle on the joints and can be done at almost any age, making it a perfect alternative for people who may be at higher risk for stroke or cardiovascular issues. Another great option is swimming. Water exercises are fantastic for building cardiovascular strength because the water's buoyancy reduces the impact on your joints while still providing resistance. This makes it a great choice for people with joint pain, arthritis, or those who need a more forgiving exercise method. Swimming also helps improve lung capacity and endurance, all without the excessive strain that comes with HIIT. The rhythmic nature of swimming also allows your body to stay in a constant state of movement without forcing your cardiovascular system into overdrive, making it a safe and effective way to stay in shape. If you're someone who enjoys a challenge but doesn't want to risk the kind of strain caused by HIIT, consider activities like yoga or Pilates. These exercises are low impact, but they still help build strength, flexibility, and endurance. Yoga, for example, incorporates controlled movements and breathing techniques that help improve circulation and promote relaxation. It's also an excellent way to reduce stress, which, as we've seen, can play a significant role in keeping your blood pressure under control. Pilates focuses on core strength and stability, which is crucial for overall body function and injury prevention. It's also worth noting that your body's ability to handle different types of exercise will change as you age. What works for you in your 20s or 30s might not be as effective or safe when you're older. As we age, our muscles, joints, and cardiovascular system undergo natural changes that can affect how we respond to exercise. This doesn't mean you should give up on fitness as you get older, but it does mean you may need to adjust your workout routine to be more in line with your body's current abilities. If you're older or have any pre-existing health concerns, it's especially important to consult with a doctor or fitness expert before diving into intense training sessions. Beyond exercise choices, another key factor in reducing your stroke risk is regular monitoring of your health. This means keeping track of your blood pressure, cholesterol levels, and heart health. If you have a family history of stroke or heart disease, regular checkups become even more critical. Even if you feel healthy and strong, you could have underlying conditions that aren't immediately obvious. Many people walk around with high blood pressure or high cholesterol without realizing it, which increases their stroke risk significantly. Regular monitoring can help catch these issues early, giving you a chance to adjust your lifestyle and exercise routine before things escalate. Maintaining a healthy diet also plays a vital role in protecting your brain and heart. Consuming a diet rich in fruits, vegetables, whole grains, and lean proteins supports overall cardiovascular health. Eating foods high in antioxidants, such as berries, leafy greens, and nuts, helps reduce inflammation in the body, which can further reduce your risk of stroke. Omega-3 fatty acids, found in foods like fatty fish and flax seeds, are also essential for heart health. These healthy fats help lower blood pressure, reduce the risk of clotting, and improve circulation. It's also crucial to stay hydrated. Dehydration can lead to increased blood pressure, which, as we've seen, can be a major stroke risk factor. Drinking plenty of water throughout the day helps maintain normal blood pressure and ensures that your circulatory system is functioning efficiently. If you're engaging in physical activity, make sure to drink enough water before, during, and after your workout to keep your body properly hydrated and functioning at its best. Lastly, managing stress is one of the most important steps in preventing stroke. Chronic stress has been linked to higher blood pressure and increased heart rate, both of which contribute to stroke risk. While it may not be possible to eliminate all stress from your life, there are plenty of ways to manage it effectively. Meditation, deep breathing exercises, and mindfulness techniques can help lower stress levels and promote relaxation. Making time for activities that you enjoy, whether it's spending time with loved ones, pursuing a hobby, or simply taking a walk, can also help reduce the negative effects of stress on your body. When it comes to fitness, remember, it's not about pushing yourself to the limit, but about finding the right balance. The goal is to stay active and healthy for the long haul, not just to push through intense workouts. By understanding your body's limits, making smarter exercise choices, and focusing on your overall health, you can reduce your stroke risk and ensure that your fitness journey is a safe and sustainable one. Your brain and heart will thank you for it. Now, while reducing your stroke risk through exercise is absolutely essential, it's just as important to focus on the overall lifestyle changes that can support a healthy cardiovascular system. It's not just about what you do in the gym or during a workout. It's about what you're doing outside of those moments too. To lower your risk of stroke, it's necessary to consider your entire daily routine, including your diet, sleep habits, and stress management techniques. Let's begin with one of the most influential factors, your diet. The foods you consume have a profound impact on your blood pressure, cholesterol levels, and overall cardiovascular health. It's well established that a diet rich in processed foods, sugars, and unhealthy fats can raise your blood pressure and increase your cholesterol levels, both of which are major risk factors for stroke. On the flip side, focusing on a whole foods-based diet can help protect your heart and brain. Foods rich in potassium like bananas, avocados, and sweet potatoes help counteract the effects of sodium, which is known to elevate blood pressure. By incorporating more of these foods into your meals, you can help maintain a healthy balance in your body's circulatory system. Also, heart-healthy fats are essential for reducing inflammation and keeping blood pressure levels in check. These include omega-3 fatty acids found in fatty fish, like salmon and mackerel, as well as plant-based sources like walnuts and flax seeds. These fats not only help lower blood pressure, but also reduce the risk of plaque buildup in your arteries, which can lead to blockages or clots. Eating a variety of colorful fruits and vegetables is another key part of an anti-inflammatory diet. Berries, spinach, kale, and other dark leafy greens are packed with antioxidants that protect your blood vessels and reduce oxidative stress, which is another contributor to cardiovascular issues. Next, let's talk about hydration. It's easy to overlook the importance of drinking enough water, but staying hydrated is critical for maintaining proper blood circulation. Dehydration can cause your blood to become thicker, which raises your blood pressure and puts additional strain on your heart. Aim to drink plenty of water throughout the day, especially if you're exercising or living in a warmer climate. If you're not a fan of plain water, try herbal teas or water with a splash of lemon. Hydration isn't just about water, though. Eating foods with high water content, such as cucumbers, oranges, and watermelon, can also help keep your body properly hydrated. Sleep is another vital aspect of a healthy lifestyle that plays a significant role in stroke prevention. Poor sleep or not getting enough restorative rest can lead to higher blood pressure, increased stress, and other negative health outcomes. Research has shown that sleep deprivation can contribute to increased inflammation and disrupt the balance of hormones that regulate blood pressure. That's why prioritizing quality sleep is essential for both your physical and mental health. Aim for 7 to 9 hours of sleep per night and establish a consistent sleep routine to ensure you're getting the deep, restorative rest your body needs to recover. In addition to sleep, managing your stress levels is crucial for maintaining a healthy cardiovascular system. Chronic stress can cause long-term damage to your blood vessels, elevate your blood pressure, and increase your heart rate, all of which contribute to stroke risk. While it's impossible to eliminate stress completely, the key is learning how to manage it effectively. Practicing relaxation techniques such as deep breathing, meditation, or mindfulness can help you stay calm and centered during stressful moments. Regular physical activity, even at a moderate pace, is also a great stress reliever. It helps release endorphins, your body's natural feel-good chemicals, which help combat the effects of stress and promote a sense of well-being. Beyond exercise and stress management, it's important to focus on your emotional health. The connection between mental well-being and cardiovascular health is undeniable. Depression, anxiety, and chronic stress are not just mental health issues, they are physical health issues too. Studies have shown that people who experience high levels of emotional distress are at a greater risk for heart disease and stroke. If you're feeling overwhelmed by stress or struggling with emotional health issues, it's important to reach out for support. Therapy, counseling, or support groups can help you manage stress and improve your emotional health, which in turn benefits your overall health. Another lifestyle factor to consider is smoking. If you smoke, quitting should be one of your top priorities. Smoking is one of the leading causes of stroke because it damages the blood vessels, raises blood pressure, and increases the risk of blood clots. Even secondhand smoke can have serious consequences for cardiovascular health. The good news is that quitting smoking is one of the most beneficial things you can do for your health. Within just a few weeks of quitting, your blood pressure and heart rate begin to normalize, and your risk of stroke decreases significantly over time. Alcohol consumption is another factor that can impact stroke risk. While moderate alcohol intake may not be harmful to most people, excessive drinking can raise blood pressure and increase the likelihood of stroke. If you choose to drink, it's important to do so in moderation. The general recommendation is no more than 1 drink per day for women and 2 drinks per day for men. If you have a history of stroke or cardiovascular disease in your family, it's best to consult with a doctor before consuming alcohol. As you can see, lowering your stroke risk involves far more than just exercise. It's about creating a well-rounded, healthy lifestyle that includes proper nutrition, hydration, sleep, stress management, and avoiding harmful habits like smoking or excessive alcohol consumption. By making these small yet powerful changes to your daily routine, you can significantly reduce your risk of stroke and other cardiovascular diseases. The key is consistency. Incorporate these habits into your life little by little, and over time, you'll build a foundation for long-term health that will protect both your heart and brain for years to come. Taking a closer look at our daily habits is crucial, but we must also acknowledge that genetics plays an undeniable role in our stroke risk. While lifestyle changes can certainly reduce the likelihood of a stroke, they can't completely override genetic predispositions. If you have a family history of stroke, heart disease, or high blood pressure, your risk factors are inherently higher, but this doesn't mean that you are powerless. It simply means that understanding your genetic risks allows you to take proactive steps to protect your health even more effectively. Genetics can set the stage, but your actions can still take center stage in determining your health outcomes. For instance, if your family has a history of stroke, it's even more essential to stay vigilant about managing the risk factors we've discussed. This means paying extra attention to your blood pressure, cholesterol levels, and your exercise routine. Regular health checkups should become a priority, as they allow you to catch potential problems early. Early intervention can be a game changer in preventing a stroke, especially if you're aware of the family history and have already made lifestyle changes to support your cardiovascular system. In addition to a family history, age and gender are other risk factors that can influence your stroke risk. As we age, the likelihood of experiencing a stroke naturally increases. The risk is also higher for men at a younger age, while women's risk increases after the age of 55, especially after menopause due to changes in hormonal levels. This doesn't mean that you should wait until these milestones are reached to start taking care of your health. Being proactive at any stage of life is key. Whether you're in your 20 seconds, 40 seconds, or beyond, implementing the right lifestyle choices can delay or even prevent the onset of stroke-related health problems later in life. For both men and women, controlling high blood pressure is one of the most important steps to take in reducing stroke risk. High blood pressure can damage the blood vessels over time, leading to blockages and potential strokes. This is especially critical for people with a family history of hypertension or stroke. It's easy to overlook high blood pressure because there are no immediate symptoms, but it silently increases your stroke risk. That's why it's known as a silent killer. Regularly monitoring your blood pressure is the best way to catch it early and make necessary lifestyle adjustments, such as cutting down on salt intake, exercising more, or even considering medication if prescribed by your doctor. Cholesterol levels are another genetic factor that can increase your stroke risk. If you have high cholesterol in your family, it's important to keep tabs on your lipid levels through regular testing. Cholesterol contributes to the buildup of plaque in the arteries, which can eventually block blood flow and lead to a stroke. However, it's not just about knowing whether your cholesterol is high, it's about understanding the different types of cholesterol. Low-density lipoprotein LDL cholesterol, often referred to as bad cholesterol, is the primary contributor to plaque buildup. On the other hand, high-density lipoprotein HDL, or good cholesterol, helps remove LDL from the bloodstream. Aiming to increase your HDL levels through diet and exercise can be one of the most effective strategies for managing cholesterol. Another factor to keep in mind is the presence of other chronic conditions such as diabetes. Diabetes can significantly increase stroke risk because it can lead to higher blood sugar levels, which in turn damage blood vessels. If diabetes runs in your family, or if you've already been diagnosed, managing your blood sugar is crucial. Following a balanced diet, getting regular physical activity, and taking any necessary medications can help regulate your blood sugar levels and protect your vascular health. It's important to remember that while your genetics may play a role in determining your health risks, they don't have to define your destiny. Just because you may have a genetic predisposition to stroke doesn't mean you are bound to experience one. The combination of awareness and action is your best defense. Through smart lifestyle changes, regular health checkups, and a commitment to cardiovascular health, you can minimize the impact of your genetic risk factors. As you embark on this journey of stroke prevention, it's also important to avoid common misconceptions about health. For instance, many people assume that the only way to lower their stroke risk is through extreme changes or rigid routines. In reality, small adjustments can make a huge difference. Simple things like drinking more water, managing your stress levels, and getting enough sleep can have a profound impact on your overall health. These changes may seem small, but they add up over time, contributing to a healthier, more balanced life. One common belief that needs to be dispelled is the notion that stroke risk is only relevant in older age. In fact, stroke can strike at any age, especially if you have underlying risk factors. Many younger people are unaware that lifestyle habits formed in their 20 seconds and 30 seconds can directly influence their health decades later. The earlier you start making changes to lower your stroke risk, the better. If you're in your 20 seconds or 30 seconds, now is the perfect time to adopt healthier habits, such as regular exercise, a balanced diet, and stress management techniques. This not only sets the stage for long-term health, but also helps you feel better in the present. Another misconception is that exercise must be intense to be beneficial. As we've discussed, moderate intensity activities can be just as effective, if not more so, in reducing stroke risk without the added strain on your body. Walking, swimming, cycling, or even yoga are all fantastic options that allow you to stay active and improve cardiovascular health while minimizing the risk of overexertion. The key takeaway is that stroke prevention is within your control. No matter your genetic history or current health status, you have the power to make informed decisions that will protect your brain and heart. By taking the time to understand your risks, make healthier lifestyle choices, and stay consistent with monitoring your health, you can significantly lower your stroke risk and enjoy a long, healthy life. Empower yourself with knowledge and action. You are the most important factor in your own health journey. As we continue our discussion on stroke prevention, it's important to highlight that staying informed about the latest health research can make a significant difference in your approach to managing your health. Science is constantly evolving, and what we know about stroke risk factors continues to improve with each passing year. For example, recent studies have shown that even mild changes in lifestyle can have a profound impact on stroke prevention. This is reassuring because it means that you don't have to make drastic changes overnight to lower your risk. Small, consistent steps can add up over time to create long-lasting health benefits. One emerging area of research focuses on the connection between inflammation and stroke. Chronic inflammation is known to play a role in the development of many diseases, including cardiovascular conditions and strokes. When inflammation levels are elevated over long periods, it can cause damage to blood vessels, increasing the likelihood of blockages, blood clots, and ultimately a stroke. The good news is that inflammation is something we can influence through diet, exercise, and lifestyle changes. By eating a diet rich in anti-inflammatory foods like leafy greens, nuts, and fatty fish, you can help reduce your body's inflammatory response. Incorporating these foods regularly can keep your blood vessels healthy, reducing your risk of stroke. Exercise, too, is a powerful anti-inflammatory tool. When you engage in regular physical activity, you reduce systemic inflammation, which not only helps prevent stroke, but also lowers the risk of other chronic diseases like diabetes and heart disease. Moderate exercise, such as walking, cycling, or swimming, has been shown to decrease levels of inflammatory markers in the body, promoting better circulation and reducing the strain on your blood vessels. Even activities like yoga and Pilates, which focus on flexibility and stress reduction, can play a role in managing inflammation and improving your cardiovascular health. So it's clear that staying active isn't just beneficial for your weight or strength. It's essential for your brain and heart health as well. In addition to inflammation, recent research is also shedding light on the importance of mental health in stroke prevention. We often think of stroke as primarily a physical issue, but emotional well-being plays a crucial role too. Chronic stress, anxiety, and depression have all been linked to an increased risk of stroke. This is because these emotional conditions can raise your blood pressure, increase your heart rate, and promote unhealthy behaviors like poor diet choices, smoking, or excessive drinking, all of which contribute to stroke risk. The connection between mental health and stroke risk is something that has been increasingly recognized in the medical community, and it underscores the importance of taking care of your emotional health just as much as your physical health. Managing stress is one of the most important ways to protect your cardiovascular system. While it's impossible to eliminate stress completely from your life, there are plenty of techniques you can use to mitigate its effects. Practicing mindfulness, meditation, or deep breathing exercises can lower stress hormones in the body and help you feel more centered. These practices have been shown to lower blood pressure and improve heart health, both of which are key factors in stroke prevention. Simply taking a few minutes each day to focus on your breath or to clear your mind can have a significant impact on your well-being. Another emerging area of interest in stroke prevention research is the role of sleep. We often overlook how deeply sleep affects our health, but studies are beginning to show just how vital it is in maintaining proper brain and heart function. Sleep deprivation has been associated with higher levels of blood pressure, increased inflammation, and a greater risk of stroke. It's not just about the quantity of sleep, but also the quality. Poor sleep can lead to irregular heart rhythms, which can increase the likelihood of blood clots. Prioritizing good sleep hygiene, such as going to bed at the same time each night, limiting screen time before bed, and creating a calming sleep environment can help you get the restorative rest you need to stay healthy. Sleep is when your body does its repair work, so don't underestimate its importance in your stroke prevention strategy. As research continues to explore the relationship between lifestyle factors and stroke risk, the evidence is clear. You have the power to significantly reduce your risk. You don't have to accept stroke as an inevitable part of aging or family history. By making small adjustments to your diet, exercise routine, and mental health practices, you can proactively take charge of your health. The key is consistency. Don't look for overnight transformations, but rather aim for sustainable, long-term changes that you can stick with. Ultimately, preventing stroke is about taking a holistic approach to your well-being. It's about acknowledging all the factors that contribute to your health, both physical and emotional, and taking steps to nurture each of them. It's about living with intention and recognizing that even the smallest changes can lead to significant improvements in your health over time. No one is too young or too old to start making these changes, and the earlier you start, the better the long-term results will be. The beauty of stroke prevention is that it's not about extreme measures or drastic life shifts. It's about making smart, informed choices on a daily basis. By staying active, eating a balanced diet, managing stress, getting enough sleep, and making time for self-care, you are actively lowering your stroke risk and improving your overall health. You are investing in your future, and every step you take brings you closer to the goal of a longer, healthier life. So continue making those small, positive choices every day and know that you're redoing everything you can to protect your heart, your brain, and your future. As we now understand, stroke prevention is not about making a single change. It's about a consistent, holistic approach to health. But how do you know if the steps you're taking are truly effective? This is where regular checkups and monitoring play an essential role. Staying on top of your health metrics can give you a clearer picture of where you stand and what you need to focus on moving forward. Regular health screenings can help you catch potential risks early before they develop into more serious problems. These simple measures could be the difference between being proactive and missing an opportunity to prevent a stroke. One of the most critical components to monitor is your blood pressure. High blood pressure is the number one risk factor for stroke, yet many people don't know they have it because there are often no obvious symptoms. This is why it's essential to get your blood pressure checked regularly. Even if you feel fine, your blood pressure might be higher than it should be, silently increasing your stroke risk. If you do have high blood pressure, there are many ways to manage it through diet, exercise, and, when necessary, medication. The earlier you identify and address the issue, the better your chances are of preventing a stroke. Cholesterol is another key indicator that should be monitored. High levels of LDL cholesterol can lead to plaque buildup in your arteries, which increases your stroke risk. But the good news is, this can be managed with a combination of a healthy diet, exercise, and, in some cases, cholesterol-lowering medications. Regular testing of your cholesterol levels is an easy way to make sure you're staying on track. If you find that your cholesterol is higher than recommended, don't panic. Work with your healthcare provider to make a plan for improvement. It's important to remember that you have the power to change your numbers with the right approach. Another aspect of health to monitor is your blood sugar levels, especially if you're at risk for diabetes, or if you already have the condition. Diabetes can damage your blood vessels over time, increasing your stroke risk. If you have a family history of diabetes or other risk factors, regular blood sugar checks are essential. Keeping your blood sugar levels within a healthy range can be achieved through diet, regular exercise, and, when necessary, medication. The earlier you catch elevated blood sugar levels, the easier it will be to manage the condition and prevent complications like stroke. Aside from these specific health markers, it's important to consider your overall cardiovascular health. This includes not just your blood pressure, cholesterol, and blood sugar, but also the overall strength and health of your heart. If you've had a history of heart disease or irregular heart rhythms, these conditions can increase your risk of stroke. A thorough checkup can identify these issues early, allowing you to take the necessary steps to manage them. In some cases, your healthcare provider may recommend additional tests or screenings, such as an electrocardiogram (EKG) to check your heart's rhythm, or an echocardiogram to assess the health of your heart valves. Of course, regular checkups aren't just about monitoring your numbers. They're also an opportunity to talk with your doctor about any concerns you might have regarding stroke risk. If you have a family history of stroke, high blood pressure, or other related conditions, make sure your doctor knows about it. This information will help them determine a personalized approach to your health and any additional steps you may need to take to reduce your risk. It's always better to be informed and proactive rather than reactive. It's also important to note that your healthcare provider is an invaluable resource when it comes to stroke prevention. They can help you develop a plan based on your specific health profile and goals. If you're unsure where to start or how to improve your cardiovascular health, ask for guidance. Your doctor may refer you to a nutritionist or a physical therapist to help you build a more tailored plan. Many people struggle with knowing exactly what lifestyle changes to make, and having a team of health professionals supporting you can make all the difference. Beyond just the medical checkup, self-monitoring is a powerful tool in stroke prevention. Keeping track of your daily habits, such as how much water you're drinking, the foods you're eating, the quality of your sleep, and your stress levels, can help you stay on track and identify any areas where you might need improvement. Journaling or using an app to track your health metrics can be incredibly helpful in creating long-term habits. The act of writing things down can often make you more mindful of your choices and can even motivate you to make healthier decisions. Additionally, having a supportive community or accountability partner can greatly improve your commitment to stroke prevention. Whether it's a friend, a family member, or even a professional health coach, having someone to share your goals and progress with can keep you motivated. Support systems also provide a sense of accountability, which can be a game changer when it comes to staying on track with your health goals. Maintaining a stroke prevention strategy is a long-term commitment, and it's about finding balance in all aspects of your life. No single change will guarantee protection, but the combination of regular health monitoring, lifestyle adjustments, and consistent support will significantly lower your risk. Over time, you'll see the results of your efforts reflected in your overall health and well-being. The goal isn't just to avoid stroke, but to live a longer, healthier, and more vibrant life. Every step you take, no matter how small, is a step in the right direction. By prioritizing regular checkups, paying attention to the numbers that matter most, and continuing to implement healthy habits, you can make a tangible difference in your stroke risk. It's not about being perfect. It's about making continuous improvements and understanding that you are in control of your health. Each choice you make today can help ensure a healthier tomorrow, and that's something worth striving for. The power to prevent a stroke lies in your hands, and it's a journey worth taking every single day. Taking care of your health involves a series of decisions that may not always seem impactful at first, but over time, these choices add up to create significant changes in your well-being. By making small adjustments every day, you are actively lowering your stroke risk and improving your overall health. As you continue to make changes to protect your brain and heart, it's crucial to remind yourself that every step you take is a step towards a healthier future. The focus should not be on perfection, but on consistent progress, making smart decisions every day that prioritize your long-term health. By adopting a proactive mindset, you empower yourself to take control of your health journey. It's also essential to understand that stroke prevention is not just about managing the obvious risk factors like high blood pressure or high cholesterol. While these are certainly important, there are other lifestyle changes that can have a profound impact. A common but often overlooked factor is dehydration. Dehydration can increase blood viscosity, making it more likely for clots to form, which could potentially lead to a stroke. By drinking enough water throughout the day, you help keep your blood flowing smoothly and your arteries less susceptible to blockages. The general recommendation is to drink at least 8 glasses of water daily, though individual needs may vary depending on your activity level and climate. Hydration is one of the simplest ways to support your cardiovascular health, yet it's something that many people forget to prioritize. It may seem basic, but the benefits of staying hydrated cannot be overstated. Another powerful change you can make to protect yourself from stroke is to quit smoking. Smoking is one of the most dangerous habits when it comes to stroke risk. The chemicals in cigarettes damage blood vessels, raise blood pressure, and promote clotting, all of which increase the likelihood of a stroke. If you're a smoker, quitting is one of the best things you can do for your health. The good news is that quitting smoking has immediate benefits. Within just 20 minutes of quitting, your blood pressure and heart rate begin to drop. Over time, your risk of stroke decreases as your blood vessels recover and blood flow improves. Though it may seem difficult at first, there are many resources available to help you quit, from nicotine replacement therapies to support groups. If you've been thinking about quitting, now is the perfect time to take that first step towards a stroke-free life. If smoking is a habit you've already kicked, congratulations, you're on the right path. But it's important to remember that alcohol consumption can also contribute to stroke risk. While moderate drinking may have some health benefits, excessive alcohol intake can increase your blood pressure, damage your heart, and increase the risk of stroke. The key is moderation. For men, that means no more than 2 drinks per day, and for women, no more than 1. If you're unsure about your alcohol intake, consider tracking it for a few weeks to see if it aligns with these guidelines. Reducing alcohol intake not only lowers your stroke risk, but also improves your liver function, supports better sleep, and boosts your overall health. Making small adjustments to your drinking habits can have a significant impact on your health and your ability to reduce stroke risk. One of the most important but often neglected aspects of stroke prevention is the impact of stress. Chronic stress wreaks havoc on your cardiovascular system by increasing blood pressure and encouraging unhealthy habits like overeating or drinking. Finding healthy ways to manage stress is crucial for keeping your heart and brain healthy. Relaxation techniques such as deep breathing, progressive muscle relaxation, and mindfulness meditation are powerful tools for reducing stress and calming your nervous system. Even something as simple as taking a few minutes each day to sit quietly and focus on your breath can have a profound impact on your stress levels. Regular practice of these techniques can make a big difference in how you feel overall, helping you stay calmer and more centered, which ultimately supports better cardiovascular health. Another often overlooked aspect of stroke prevention is sleep. The quality of your sleep affects many areas of your health, including your brain and heart. Poor sleep has been linked to an increased risk of stroke, as it can contribute to high blood pressure, inflammation, and irregular heart rhythms. Sleep is essential for allowing your body to repair itself and maintain healthy functioning. If you struggle with sleep, focusing on good sleep hygiene is key. This means establishing a regular sleep schedule, avoiding heavy meals and caffeine before bed, and creating a restful environment that promotes deep, uninterrupted sleep. Prioritizing sleep is one of the simplest yet most powerful ways to protect your cardiovascular health. It's also worth noting that mental and emotional well-being is a key factor in stroke prevention. As we mentioned earlier, chronic stress can have serious health consequences, but other factors such as depression and anxiety can also increase stroke risk. People who suffer from mental health issues may be more likely to engage in unhealthy behaviors like poor eating habits, lack of exercise, or smoking, all of which contribute to stroke risk. If you are struggling with mental health issues, seeking support from a therapist or counselor is a critical step in improving both your emotional well-being and your physical health. It's important to recognize that mental health and physical health are deeply interconnected, and addressing one can have a positive effect on the other. Finally, if you have a family history of stroke or other cardiovascular diseases, it's especially important to be proactive about your health.